Hello and welcome to the Reduce Aggressive Behavior Without Trauma webinar. It is my pleasure to introduce Dr. Deborah Beer, PhD, the creator of DementiaWise. Dr. Beer is the ComForCare at your side dementia care specialist. She's been a psychotherapist and non-medical home care director for nearly 25 years and holds a doctorate degree in therapeutic counseling. Debbie has been certified by the Massachusetts Alzheimer's Association and the Commonwealth of Massachusetts to train dementia caregivers and coach dementia families. Welcome, Dr. Beer.
Thank you, Lori, and thank you to everyone who's here. And let's get started. This is an important topic that is very difficult for a lot of people, so I'm glad that you're here. So today's agenda, we're going to talk about why people with dementia become aggressive or violent, how to prevent aggression and violence, how to respond safely to them, and some words about calling 911 following these incidents, and then some additional resources. First, I want to point out, though, that dementia and Alzheimer's terms are often confused, and I want us to be clear about what I'm talking about when I say these words today. Dementia is a group of symptoms that have to do with cognitive impairment, and there are many types of dementia. Alzheimer's is one of those types, and in fact, it's the one that we hear the most about because it's the most frequently diagnosed. But not all dementia is Alzheimer's. Some of it is other things, but all Alzheimer's is dementia. So, whoops, now you'll understand what I mean. Okay, so why people with dementia become aggressive or violent? Before I talk about that, I just want to say that I really believe that most caregivers are working really hard under really difficult conditions, doing the very best that they can. Caregivers are exhausted and overwhelmed. There's just an endless number of things to do. And often you're accomplishing the impossible and nearly impossible in a situation where you usually don't have the kind of support that you need. And that includes not having the best practices training that you really need. And that's true for both family and many professional caregivers as well. And caregivers really deserve the best support and training possible. In fact, people with dementia deserve to be cared for by caregivers who have had the best support and training possible. And what I'm here to do today is to make your job easier and more effective, and to make caregiving a satisfying situation, because caregiving can be very gratifying personally and can help us really understand our strengths and feel good about having managed a difficult task with someone who we care about. So I don't want you to take today's information as blame or criticism when I talk about what caregivers are doing wrong. I understand you're doing your very, very best. So I want to say that aggression and violence, particularly aggressive behavior, is not unusual with dementia, but it's not really a feature of dementia itself. It's not usually caused by the dementia itself. So it's not inevitable. It's usually triggered by events in the person's environment or conditions in their environment. And I really believe that most aggression and violence can be prevented, or at least reduced in severity and frequency. And we're going to also talk about the best practices to de-escalate aggression before it becomes violence, before someone gets hurt. So very common reasons for aggression and violence are that people with dementia become just unbearably upset and anxious and frightened by things that are going on around them in their environment that they can't understand. And when they're getting aggressive or violent, they feel that they are fighting to survive and to protect themselves. And they're fighting for a quality of life and dignity and respect and understanding from people around them. And when these things get out of control, aggression and violence can be the outcome. And caregivers really need and deserve the right training to prevent and reduce aggression, but rarely receive it. And the training you're going to receive today is very rare and unusual, but yet it's not difficult to learn, and that really makes it all the more heartbreaking. So I'm really glad that you're here. There's this idea that people with dementia, because they have injured ability to remember things, that they can't be traumatized by bad events that go on in their environment, things that make them frightened or upset or angry. But that's not true. People with dementia can experience emotional trauma for a very long time, even though they have no idea what caused the trauma in the beginning. They can retain those feelings for a very long time. In fact, so long that they can have feelings of post-traumatic stress disorder, even though they can't remember what caused it. And people with dementia, they don't easily forget strong feelings that are connected with person, place, thing, or events, even though they don't remember that what the original exposure was. And so when they're in a situation where the scary emotional memories get triggered, they may act to protect themselves, and suddenly they'll get aggressive or violent, and we don't know where it's come from. Sometimes it's because they're re-experiencing a trauma, and something that's going on reminds them of it. Even though they can't remember the event, they have all those feelings, and they realize they have to protect themselves. So let's talk about preventing violence and aggression. We hear caregivers report these events, and they use some pretty characteristic language. One is, he hit me, it came from nowhere, just very sudden assault or very sudden aggression seemingly out of nowhere. The fact is, we can learn to look for triggers, and we can look for the symptoms early on, and when we see them, and they're going to be particular for each person. It's not a one-size-fits-all, but we're going to have to learn each person's triggers. We can de-escalate what's going on in the moment so that it doesn't end up becoming violent, or started out violent, it doesn't continue being violent. And I believe the key is to create an ongoing environment where the person with dementia feels less upset, less anxious, and less frightened, and is actually having good emotional experiences in their environment. And that way, they're not so at the point of being triggered into aggression and violence, that it takes more than just a small thing that they consider to be an insult or a trigger, that they're already at a lower, more calm and peaceful level on an ongoing basis. And that's what we're going for. Another thing that caregivers say is, oh, she always gets aggressive when X, Y, or Z happens. That's really important information. We want to look for those patterns because those are really helpful to understanding how to improve the situation and how to prevent or reduce the aggression or violence. I have to say that caregivers are most frequently the trigger of aggression and violence, and I know this is not done on purpose. Caregivers, you're not crazy, and you're not cruel usually. Maybe we're all a little crazy, but we're not crazy enough to intentionally trigger aggression and violence in someone with dementia. It's something that we don't realize that we're doing. But in learning to avoid common triggers and learning to understand the triggers of that particular person, I believe we can really prevent a lot of aggression and violence. And also by making those improvements in their care and their environment on a systemic basis, on a daily basis, violence and aggression can be prevented or addressed successfully and quickly when they might happen. So here are some of the things that we need to understand to do this. One is that people with dementia retain all of their emotional life and abilities. And if we increase their positive experiences, they're going to end up having a happier and more peaceful day. And that's going to lead to less likelihood of aggression and violence. We also need to realize that people with dementia can read the emotions of their caregivers and other people around them. They can read their body language long after they can no longer understand spoken language. They can read you like a book. so that if you have tense body language or you look like you're loaded for bear or you're just waiting for that aggressive moment to happen, they're going to get triggered by your body language. They're not going to understand what you're anticipating, but they'll think there's something wrong or that there's something wrong between you, and they're going to be easy to trigger to aggression and violence. So you always have to check your body language and make sure that you're only bringing the emotions into the room with the person with Alzheimer's or any other dementia that you want to see coming back to you, and they're often coming back magnified. So if we come in tense, we're going to see someone with dementia is tense. If we're coming in happy and having a good time, the person with dementia is going to naturally be more relaxed and happy. We also need to realize that people with Alzheimer's disease lose their peripheral vision. It's not a disease of their eye. It's a disease, it's part of the Alzheimer's effect on the brain that they can't process visual information in their brains. So that very often caregivers, of course not knowing this, come up out to someone with dementia outside of their field of vision. They come from the side instead of the front, and they might startle the person. And often that can end up in aggressive or violent behavior. So we want to know, always approach the person from the front, not from the side. We always want to be person-centered in our care, and that's part of improving the environment for people with dementia. When we have person-centered care, it means that we never let the person with dementia know that they are a task on our to-do list, that we're there to be with them, to do care with them, not to them. Okay, so we always want to stop every care task, before every care task we have and every interaction, we want to stop and spend a few minutes making a warm connection with that person. And that may be chatting or singing or looking at pictures or giving a hand massage or looking out the window, listening to music, just so that it becomes personal and that you renew your warm connection constantly. Another important thing is to know is don't step into arm's reach of a person with dementia to do some kind of a care task until you gauge what their mood is. If they look like a thunderstorm, don't get closer. You might get hit. They might feel that they need to up the ante and get aggressive. Just use your warm connection until they calm down and they look more friendly. If they look friendly when you come to them and you start to make warm connection and you make eye contact and they look welcoming, that's a good sign. But you always want to check the temperature, their temperature. Are they running hot or cold before you get close enough and within arm's reach? It's also really important to know that people with dementia want to feel respected and that they have problems with frustration. So it's important that caregivers learn to never argue or correct people with dementia. It just doesn't work. They don't remember the correction, but what they do remember is that they're feeling disrespected and frustrated. So we need to learn and practice these communication best practices. Not arguing and not correcting is not something that's easy to learn. It's an old habit that we need to break, and habits take a little while to break. Keep at it. You will find as you're working and you're doing better, you'll suddenly hear yourself arguing, correcting. Just know that you should stop, and you'll get better over time with that. It really makes a huge difference. An unrecognized source of aggression is undermanaged pain or unrecognized pain. People with dementia don't tend to complain of pain, yet they experience pain as much as anyone else. And in fact, certain kinds of stimulation, tactile stimulation, touch stimulation, will be painful to them in their perception when it wouldn't be to you or I. They can't articulate that they're in pain. In fact, you might ask them if they're in pain. They might say yes, but they might also say no. And the problem is they don't understand the meaning of their bodily sensations as dementia progresses, so that they might be in tremendous pain, but they don't have the ability to understand what the word means and to attach it to their experience. They also can often not locate where the pain is in their body. So we need to know that if this person is acting out in a way that is not normal and we can't redirect their aggression or other difficult behavior, that what they may be experiencing is pain. Another reason that some people can get aggressive is that they've had too much sensory stimulation, too much noise, too many people, too much light, too much activity. And we need to get them into a more quiet place, a more quiet state to get them calmer. And what they're communicating is, I just had too much. Another reason that they might strike out is that they might be startled. And it may just be a protective reflex, like when someone surprises you, you may, throw out your hand and might accidentally knock something over or hit someone. They don't have the inhibitions that they used to have, so they can't suppress those protective reflexes. So it's important that you always keep in communication with the person with dementia and tell them what you're doing before you're going to do it. For example, if you're going to help them get undressed, you don't just pull off their clothing. You let them know that you're going to do it, and you talk them through each step, even if you're not sure if they understand your language any longer, if they're unable to speak or understand language. They understand the care that you're projecting to them in your speech, and they understand your tone of voice and your body language. So know that they're watching and they're understanding a lot more than you necessarily would believe, particularly once they've lost a lot of their abilities around language. So let's think about how to create good solutions for preventing or reducing aggression and violence. And we need to understand that difficult behavior is actually a form of communication when it comes to someone with dementia. This is especially true when they no longer have the ability to use language, or they're using language very minimally. They don't have another way to communicate. So going back to that example where people might be overstimulated with too much noise or too much activity, they can't say, this place is really too much for me, I need to leave. Acting out may be the only way they have of letting you know that. And of course, each person's triggers for aggression and violence are going to be individual, and so we need to customize solutions when we understand those triggers. We need to look deeper under the surface to understand what are their needs they're showing. So for example, if someone gets very agitated and repeatedly demands to go home, even though they are where they already live, of course, we're not arguing or correcting. We're not saying you are home already and then arguing about and then trying to prove that. Instead, we're listening under the surface and we're saying, go home. What is this about going home? What does that mean to this person? Does going home mean they want to be in a place that seems more familiar? Maybe they need more of familiar objects around them. Are they saying, I want to go home because they had a role at home that that was understood and they felt more purposeful and they understood that they were contributing? Well, maybe this person needs some ways to contribute to wherever they're living so that they feel a sense of purpose and appreciation. Whatever it is, it's going to be individual, and we always need to say, what is the unmet need that they're expressing through this behavior? And that is the step before we find a good solution. We can find lots of solutions, but when we don't understand what the unmet need is, they're never going to meet that person's needs and de-escalate the aggression. So let's talk about how to respond safely to aggression or violence when it happens. Let's face it, we're not perfect as caregivers, and unexpected things happen, and we may not be able to prevent every instance of aggression or violence. So we need to know how to respond in a way that's safe and will quickly de-escalate the problem. So we hold that in readiness. So let's look at some of the do's and don'ts for responding to aggression or violence. The do's all have to do with creating calm, comfort, and distraction from whatever their upset is. The don'ts, well, they would tend to escalate aggression and may cause violence. So with the do's, you want to first step away out of their easy reach so that they can't take a swipe at you. You want to get calm, and even if you can't feel calm, you want to act calm, because remember, they're reading your body language, and they're going to respond with like emotions. So if you're calm, they will get more calm. So check your body language, and you want to make warm connection. You want to make sure that you're getting them into a better mood. Talk about things that they enjoy and show them respect, care, and warmth. The kinds of things that we might do impulsively if we don't have the right training or practice or coaching is we might challenge them and argue with them. We might grab them, get in their face to try to de-escalate it. That actually increases aggression. If we show aggression or anger or call them names, they're all very natural impulses after someone's been aggressive or violent with us. That actually is going to continue to escalate the aggression. We don't want to punish them because they don't understand the connection between what they did and the punishment, and they may not even understand what they did was wrong or remember what they did. We don't want to use restraints with them unless we absolutely have to, because otherwise they would severely hurt someone else or themselves. Restraining someone can cause them harm, so we want to de-escalate instead. We don't want to hit back, although it can be tempting at times when you're on your very last nerve and you're dealing with aggression. And of course, we don't want to correct, argue, or criticize, because that will escalate difficult behavior. The only exceptions to these do's and don'ts are when there is a considerable injury or imminent threat to safety. Safety always and well-being always have to take precedence. So after you've immediately diffused the momentary situation, you want to then make the rest of the day all about being calm and increasing positive emotions, because this person, they may look calmer, but their trigger is close to the surface after they've been aggressive or violent. And then very soon afterwards, you want to start assessing what were the triggers for this incident, what was going on, and what does it have in common with other incidences, even though maybe they don't make sense to you. You just want to find those commonalities. And what could you have done differently or better? And do it soon, not so that you can jump on beating yourself up as soon as possible, but because you want it to be fresh in your mind if possible. And then in the longer term, you want to start asking, well, what are the patterns here? What are the needs that this person is expressing, and how can we best meet them for this individual? Of course, always the answers are customized. Calling 911 following an aggressive or violent incident. So if you are present on the scene, you are the person who are most informed about if or when to call 911. And so you are going to have to always have the best decision-making capability. And I can give you advice here, but I'm not there at the incident. But nonetheless, I'm going to still give you some advice. Always think of calling 911 when there is imminent danger to the person with dementia or someone else, or when someone is injured and they need immediate medical attention. Okay? But I want you to think about what circumstances there might be that 911 shouldn't be called, or maybe you should think about it a little harder before you call. There are some common reasons that I don't think are necessarily helpful and, in fact, escalate the situation. One is that those are very understandable, and I totally understand the feelings about that give rise to these. Just that 911 may be the wrong tool to use. And one is that the caregiver is just at the end of their rope and they can no longer stand the situation, so they call 911. Not imminent danger, no one's injured and needs medical attention. Or the caregiver is just angry, upset, and feels terribly insulted. Another reason that people call 911 that I don't think is helpful is to scare the person or to teach the person a lesson, particularly with dementia. They may not understand that lesson or associate the appearance of the police with what they did. They may not remember what they did or what happened. And I really have to think, are these reasons to call 911? And there are consequences that you need to be aware of when you call 911 for these reasons that are not, I think, true emergencies, although, of course, you are the one to judge that because you are there. First responders are not generally trained in dementia care best practices. So this is a service actually that we provide to first responders, but we have not hit all the first responders in every community in the world. So many of them are not trained, and what they often do will rapidly escalate aggression and violence, not because they're trying to, because they don't know what else to do. And they tend to use often force instead of calm talk, and people can get hurt. The person with dementia can be badly hurt because they may be struggling with the first responders. They might be tased and experience not just the harm of the tase, but a fall injury like breaking a hip. And some of these injuries they can die from. They can be badly emotionally or physically traumatized. And you, as the caregiver seeing this, will be badly traumatized. And first responders can also get hurt and traumatized as well. So let me talk about some additional resources as we're finishing up. If you're a family member of someone with dementia or a healthcare professional needing to manage dementia care or dementia caregivers or families, our offices can assist with strategies and solutions for your challenges. So please contact your local ComForCare or At Your Side office for about our services. In ComForCare, ComForCare.com and AtYourSideHomeCare.com are here on the screen, as well as their 800 numbers. And At Your Side Home Care is in the Houston, Texas area. And if you're interested in learning more about DementiaWise methods, there are many other features to our program. So please look for DementiaWise presentations and family caregiver support groups in your area where there's a lot more to learn. You can also sign up for free information about dementia and other topics by visiting ComForCare.com or AtYourSideHomeCare.com.